So Melinda Ellsworth, Director of Donor Services at Science Care. I like Science Fair, but Science Care, calling in from Phoenix, Arizona. Welcome to our show again, Melinda.
Thank you so much for having me. I love being on the show.
I love having you on the show. It's funny to be so enthusiastic about dying, isn't it?
I know, but it's not about dying.
I know.
It's not. It's about giving. It's about giving.
I know. I'm always kidding. It's funny. Every time I pass a funeral home, I say, you guys have no idea. But, and I know we're laughing about it, but it is something that, of course, it's very serious. And most people, I found now, the boomers are not making any plans. They're not like the older folks that used to do this when they got married. The first thing they did is they bought their funeral plans. And so many of the boomers are so interested in what your company does. And I think it's a good time to just going to let you have the air for a little bit and explain it.
Sure. So Science Care is an alternative to traditional funeral or cremation. We're a whole body donor program. It's a tissue bank, so folks like you and I can donate our bodies to medical science. And we, Science Care, are the link between donors and those medical researchers and educators who need human tissue to do very important work to advance medicine. And, since I last spoke to you, I have some interesting facts. We did some research, and we've been in business for 14 years. We're nationwide, and we have an office there in Coral Springs. But every donor that goes through the Science Care program, on average, will participate in 5 research or training programs.
What does that mean?
That means that each particular donor, we will procure tissue, and those tissues will be a part of research for 5 programs all over the world, all over the country. It could be a brain research program. It could be training surgeons on the latest hip replacement technique, as well as training a surgeon on how to remove a pancreas or whatever training is necessary at that time. Our job is to maximize the intent of each donor and place those donors with as many projects as possible.
Wow, that is good news. So now I wish we had written a column. Maybe we have to go back and do that. I think that's that's thrilling now, because a lot of people don't really understand. Maybe they think they just get their body shipped somewhere and it's just used as a whole body. But you're telling me that different parts of that body are being used for research.
Absolutely, yes. And in fact, yes, we do support medical schools around the world, but that's a very small portion of where the donors are going to participate in medical research. Most of the time, it's really for treatment development, so research and development organizations and institutions, as well as training of surgeons. So hands-on surgical training, so that those surgeons, either they're performing new procedures, they're learning new techniques, working with new devices in that surgery, and they need to become skilled before going into a patient, or there's a complicated surgery. And we've had many cases where surgical teams will want to utilize cadaveric tissue through our program to practice a very complex surgery before going in and operating on the patient, so that they have a better outcome with that patient.
That is extraordinary information, and I'm glad that you were able to bring it up. But now we have some other exciting information, and we're not going to use names or anything, but we always, which we know we have a very large listening audience, and they do take what we say seriously, whether it's someone like Melinda talking about Science Care. We have physicians, we have entertainment. I just came back from the Malt cruise for 7 days, and that was one of the sponsors of our expo, and it was packed solid, 2,800 people, and we didn't get all of them, but there were a good amount that came because of the radio show. So we know the radio show works, and we're so happy. And one example is we had a very nice woman in her 90s who heard the radio show, and she was excited about Science Care, and has her sister, and she and probably a couple of friends will be doing this. And I thought, isn't that interesting? And we don't ever think of people, at least I don't, in their 90s thinking about this, assuming they've already done something. But maybe that's not true.
Yeah, absolutely. There are so many people who never think of this. They never consider what options they would like to choose at end of life. And what's interesting about this program of donating your body to science is there are no age limits. So the 90-year-old, the 99-year-old, all are good candidates for donation. We have a very broad criteria for acceptance, so most everyone will qualify. The main rule-outs are contagious disease and extreme obesity, but other than that, nearly everyone qualifies. And so we are happy that we're so successful at being able to place each donor with, like I said, on average, 5 research projects to really honor the intent of each donor.
It is great, Melinda. And when you told me also 14 years that you've been serving the public doing this, that is a long time. And I know that I think you once told us about the gentleman who started Science Care, and maybe you could reiterate that. Sure.
Yeah, Jim and Josie Rogers, husband and wife team. They still own and operate the company today. Jim worked in pre-need planning, so meeting with folks across the dinner table, talking about final arrangements. And in those conversations, oftentimes people would ask about donating their body to research, and he didn't have an answer. There were no answers, no good answers at those times for the amount of people that were interested in this. Yes, you can donate your body to a medical school, but those programs are limited in the number of people and the type of donors that they can accept. And so he went about taking a couple of years to do some research, modeled the Science Care program after transplant tissue banks, and created the concept of a non-transplant tissue bank, Science Care, and we've been growing ever since. It's just been amazing in the last 6 years to see the growth in the movement of whole body donation for medical research, the awareness in the public, the desire in the public to be a part of something greater than themselves, to be a part of giving back to future generations in a real and concrete way. It's really exciting to be a part of.
Yeah, it is. And I think the baby boomers are really leading the charge on this. It's interesting. I had a conversation with someone recently, and the person's father had just had a stroke, and I started talking all about this, and they got very upset with me, and they said, forget it. They've already made plans. And these people don't have very much money. This is what he wants to do. He has already bought his funeral arrangements, and he's going to be, he wants them flown up to Pennsylvania where his mother is, and he wants to be buried with her. I said, okay, I just, it's like, it's not my company. I said, no, I'm sorry, and I let it go. And I thought to myself, they have no money, and they're going to now, you know what that's going to cost to do all that?
Oh my gosh, a lot, thousands of dollars.
I know that. I know that, but
the average cost of a traditional funeral across the country is $9,000.
Oh, well,
that's a lot.
Melinda, they couldn't dream of having $9,000. So this is going to be a very interesting thing for them. But I realized that they weren't looking for my help in any way, so I just backed out of it. Because I think that old part about being buried next to somebody, I mean, if now, as you said, you want their ashes, you can sprinkle the ashes over them, that'll work, right?
Mm-hmm. Yeah, absolutely. We do return cremated remains to the family members in 3 to 5 weeks, so you can have a memorial service. You can scatter the ashes wherever you like. We also, if you do not wish to have ashes returned, we can inter the ashes or scatter the ashes off into the sea as well for you. So there are lots of options. And, you hit on something very important here. This is not for everyone. The concept of donating their body is such a tremendous gift. It's such a gift of love and concern for future generations. And it's not common, and so it's not for everyone, and that's okay. It's very important that we honor people's wishes at the end of life, and that's what this is about, right? So when you join the registry with Science Care, you are stating your wish. You're stating your wish to your family, to Science Care. This is what I support. This is what I want to do. And so at the time of passing, it makes it easier for your loved ones to fulfill your wishes. They know what you want. They want to honor your wishes, and this is a really beautiful way to do that.
Yes, and you, of course, should be talking about the vets because we just had Veterans Day, excuse me, and you do something very nice for veterans. Why don't you share that with our audience?
Absolutely. So on the front end, right, the donation part of with vets, this program works very well with normal veterans benefits. So you can still take the ashes and have them interred with honors at a national cemetery at no cost, just per normal. And the beautiful part of this is that with going through Science Care, there is no cost to cremation. The outcome of whole body donation is cremated remains, and this is at no cost to you. The whole program is at no cost to you. So a veteran can go through the entire program and have cremation, interment at a national cemetery with honors, all at no cost. Okay, and on the medical research side, our veterans and every donor have the opportunity to work with military-type projects in which they're working to research and develop ways to protect military personnel life by improving safety structures in vehicles, to prevent damage and injury and trauma to the body if they had to eject from a plane or if there was a helicopter crash or something like that. They're also working to develop better personal protective equipment for all military personnel, specifically to protect the neck, because this is a key area of vulnerability for flying projectiles, especially in an area where we have lots of bombing activity. So being able to protect the neck area is very critical, and our donors are helping to develop better personal safety equipment for our current serving military members.
Wow.
So, yeah, it's fascinating. And you wouldn't even believe this, but 1 out of 3 Science Care donors is a veteran. 1 out of 3. It's an amazing statistic, and, I'm not quite sure what to tie that to, but, our vets, they give back their whole life.
Yeah.
They give back to others. And it just seems like it's another way for them at their end of their life to give back to even more, potentially millions of people by helping to improve and advance medical care.
That's a terrific discussion, and we haven't really had that before, but you're right. The veterans have always given, and now they're giving back in a different way. That's maybe another way we should be talking about this, because the families of the vets especially, they should be carrying on giving back. That's what the vets would want to do. When they went out and fought the wars, they knew their bodies, that they would be killed if, unfortunately. So here now they can actually have their body given to do some more good service.
Absolutely. Yeah, and we're a service provider, right, to the families as well. So our job is to facilitate the donation, absolutely. But it's also to be there for the family, help them through the process, give them information they need so they understand the process, they understand the medical research, the implications to the public, to public health, and it's no cost. So, if there are no funeral arrangements made, there is no pre-planning done. You can go through a program like the Science Care Body Donation Program, and there's no cost to the family. So that's a great benefit.
Yeah. Melinda, every time I talk to you, it seems like, okay, what are we going to talk about this time? But we always find something, don't we? It's like, well, you aren't so enthusiastic also. It's just always such a pleasure to talk to you. In fact, let me tell everyone, my guest is Melinda Ellsworth. She's Director of Donor Services at Science Care. She's calling in from Phoenix, Arizona, where their headquarters is. And let me just also tell you a toll-free number to call. So if this is of interest to you, all you need to do is call this number. They'll send you out an information kit. They are open 24 hours a day. So the phone number is 1-800-417-3747. That's 1-800-417-3747. And the information booklet is very clear, very smart. You'll be able to sign up. It doesn't cost anything to sign up. They give you a little card that you carry in your wallet. My husband and I carry these little cards in our wallet. And I just actually told my son the other evening about Science Care because I think they need to know. All your family members need to know. So if you want to go on their website, it's sciencecare.com. Sciencecare.com. And someone else was telling me they were very excited about having their ashes. They were going to be cremated, and their ashes that would be going down to form a reef. I don't know what it's called, reef burial or something. But when you think about it, Melinda just said that, if you're going to have cremation, it's going to cost money. No matter what, it's going to cost you something. But with Science Care, it wasn't going to cost you anything. They're going to use whatever they can for research, medical research, and then they will cremate the remaining parts, and then they will bring back the ashes if you so desire. Do I have that right?
You're absolutely correct. Yep. And we can return the ashes within 3 to 5 weeks, and we're pretty quick at that, so it's more closer to 3 weeks. And like I said before, you can have a memorial service, and many people don't know this, but you can have a memorial service or celebration of life before you get the ashes. You can wait, take some time, schedule to get all of your family together, or you can do that immediately. And we can help to guide you and give you information and resources about questions like this. Our staff, the Family Services Donation Coordinators, they work 24 hours a day to answer all of your questions, to help you through the process, and to make it as easy and as simple as possible, because we know that the family is grieving. We know it's a difficult time, and so we try to do everything we can to make it crystal clear and easy for you.
And the expo's coming up. The Boomer Expo's coming up in January the 20th. And if you don't do anything beforehand, which I think you should, but if you don't, you can stop by their booth at the Boomer Expo and talk to one of their representatives. And then you can pick up the information there. We really appreciate your thinking about this. And I always try to be a leader in many things. When long-term health care insurance first came out and I was 57, I bought it. And I bought it right, as they say, because I appreciate the advertisers and I know so much about it. And we always try to do that. I've bought many, many products from our advertisers, and Science Care was the first time I'd really even heard about this. I think my husband had thought he was going to go with one of those cremation, societies, and once for this we did this. That was it. That's what we're doing. So I really hope people will, follow the leader, as they call me many times in South Florida, with things like this. It's really important that you take care of these issues, because you're going to leave your family suffering. First of all, they won't know what you want or what they should do. Money is tight, and even for people who have a lot of money, it's just a giving back, and that's such a good way that Melinda talked about it, especially veterans, is just giving back more and more. And I know so many physicians, and I've told this to Melinda, and I'm always kidding with them and asking about the things that they enjoyed when they were in medical school. And I always ask about that, the dead body. Did you really like that? What do we call that again?
The cadaver.
The cadaver, right? A cadaver. Yeah, exactly, the cadaver. And they always say, "Oh, I really learned to love that cadaver," because that's what they learned on. So we really do care about this. We care about research. We work with Scripps Research up there in Jupiter, and they are finding not cures yet, but they're finding a lot of excellent research that the pharmaceuticals will be able to jump into, and hopefully will cure Alzheimer's, and it will cure cancer and all the other terrible diseases. So we need to give everybody the best shot we can, and this is free. I mean, that is still, I think, Melinda, you all could charge for this, and it would still be good.
Well, it just wouldn't feel right, though. I mean,
I know.
The gift of your body is just tremendous. And so, for us, it's an honor to be able to place the donor and to make that work. And what happens is the medical researchers and educators, they fund us, right? So they are the ones who are helping to keep Science Care going and growing, because they're paying fees for all of the processing. This is not an easy process. It's quite complex, and we have to be very careful and care for safety and preservation of the tissue and things like that, and honoring the dignity of the donors all throughout the process. So the clients and medical researchers and educators, they're the ones who are paying fees for the procurement of tissue, the processing, the shipping, the testing, all of that, and they help to keep this program growing and growing. So kudos to them. And, what you were talking about before with researchers, they're not always able to find a cure. But with the advances in the technology and the application of technology and treatment, they're able to make people's lives better, longer, and more active through improved treatments and health care for patients.
Well said, Melinda, well said. And I'm right there with you. And I was thinking about some letters that I'm sure that you get from family members after the event that someone dies, and they tell you how appreciative they were of how easy it was and what you did for them.
Oh, we get letters every day. We get emails. If you look at our Facebook page, people post on Facebook. That's the reason why I work here. That is the reason why I do this work, and why almost everyone, especially family services who's dealing with the families, they love helping people and being able to make those connections that really make people feel good about giving back. And those letters that we get from families afterwards, it's just heart-wrenching but beautiful as well.
Well, when you think of it, we're talking about death and people being appreciative. I mean, you see, that's not something we normally would think about, but I suppose when someone passes away and everyone gets together, they talk about it, that it's not like let's just go to the cemetery and, and honor that person. It's like, can you imagine now that mom or dad or whomever it is could be helping somebody by their dying? At least it isn't so final.
Absolutely. This is a way to really live on. And not just immediately, right? Not just training that surgeon today for that patient today, but for future generations, right? Developing the treatments that help generations of people to live better lives, to have better treatments, better diagnoses of illness. And so it's not just a one-to-one correlation. It is a multiplier effect. It's a huge legacy.
In the short time we have left, let's just talk about the procedure. So someone who is obvious they're going to die, they're either in hospice or they have just died, and they are a science care member, and the family calls and they're taken away. So they now, let's say it's here in South Florida. Tell us exactly what happens from that point.
Yep, sure. So the family or someone would call science care 24 hours a day, and we take over from there. We're responsible then to get the donor into our care, so we cover the transportation of the donor into our care and everything through return of cremated remains. On that call to science care, there will be a quick 5 to 10 minute questionnaire about medical history, and that tells us that we can proceed with donation. At that point, we're hanging up the phone, emailing information, consent forms, information for the death certificate, things like this to the family so they can complete that at their own pace when it's comfortable for them, and then returning that back to us. And it's as simple as that. We stay in touch with the family for many days throughout to offer resources, to make sure that the family knows what's happening with the process, and things like that. And then a month after donation, we send a letter to the family talking about, in general terms, the types of research programs that were going on in that month so they can get a better, more clear understanding of the types of programs their loved one may have participated in.
Yep, it's almost like having a plaque on the wall, and saying, maybe, what do you give them when after everything has done? You give them some sort of a certificate or what?
We send them the letter, which talks about the research, and then 1 year after donation, we plant a tree in their honor, in the donor's honor, in partnership with the Arbor Day Reforestation Project. And so we're planting thousands and thousands of trees every year for every single donor, and we send a certificate of that tree planting to the family. And I have to tell you that, interestingly, the families really love that, especially a year after passing. It's a difficult time, and it helps them to remember this lasting, living legacy that their loved one has given.
You had told me about this, and I forgot this, Melinda. Yes, that's beautiful, because you don't know this, but when someone passes away and I talk with them, I'll say, and they're feeling very sad, I'll say, why don't you plant a tree in that person's honor. I always do this, and I had forgotten that you told me that your company does that.
Yes, we love working with the Arbor Day Foundation, and every year thousands and thousands of trees are planted just through Science Care. And for every client, every new medical researcher that we take on, trees are planted as well. It's just, we feel like it's a great way to leave a living memorial in the world, another good way.
And let me tell you, I wouldn't be surprised that if you locate where those trees are, that people won't go and visit.
Yeah. You know, what we're doing is we try to find a location that's in our core state. So, for example, in Florida, Seminole Forest was one of the years we planted for every donor that year in the Seminole Forest. Yep.
I don't even know where the Seminole Forest is.
Yeah, you know what? It's somewhere, I think, in the middle of Florida.
Isn't that something? Well, this is great talking to you because things keep coming up, and maybe we have just a little bit more time. We used to live on the ocean in Palm Beach County. We just recently sold our home, and what we would have at our house, because it was a road just between our house and the ocean, and so we would have guests come to our home, and if someone passed away, we'd have a memorial service in our home, and on the beach area, we would plant a coconut, which turned into be a coconut tree, and we would then name it. We had a wall in our home that had the list of everybody when they died. I mean, this is sick. I mean, it's not sick, but I'm saying it's so funny to be talking to you about this. I had never told this to anybody. Isn't that funny?
Wow.
Yeah.
That's amazing.
You and I were made to be together, Melinda. You know this.
You're right.
Oh, my gosh. Well, listen, as usual, it's so wonderful talking with you. I always learn so much, and we're going to get you more people all the time.
Great. Please, yes, tell all of your listeners, just call us, and we'll get you signed up.
Right. Thank you, Melinda, so much. Remember, just you can go to their website, and you'll find everything there, and that's sciencecare.com. Thank you.
Thank you.
Bye.